Bryce, Dr. Buford here with Mitzi and the rest of the shoulder team. We're just getting started on the right shoulder. We examined your shoulder before we started and there was no stiffness. We were able to take your shoulder through a full range of motion with no signs of any stiffness or adhesions. So we really didn't have to do a manipulation, so that was encouraging. And now we're getting our first look inside. Here's the biceps tendon running up. And I'm going to rotate the camera down. We can see this suture, that looks good. Okay, that looks very healed. You can see how they get incorporated. And the other one in the front I can't even see, it's been completely covered up, so I'm happy with that. Okay. I'm going to look towards the back of the shoulder. Remember, we did a little bit of work back here. You can see the two sutures. Again, the suture knots are solid. And maybe clip that one a little bit. But the knots look solid and the labrum looks healed. And we can back up and look at the rotator cuff. The rotator cuff still looks great. No signs of any problems here. There's the normal bare area of the humeral head. You can also see the posterior attachment. The posterior capsule looks just fine here. Okay, we'll come back around the front. And as we look down here, this looks great. That couldn't look any better. You can see the sutures are completely covered up. I'll turn up the brightness just for a minute. Okay, you can see this little stripe of blue where the sutures were. And that looks great, okay? So let me turn the brightness back down now. Okay, so now I want to put the camera in the front and have a look from the front to the back. Pause, please. Okay, we're just doing a little bit of polishing here. This wouldn't explain any loss of motion, but we're just smoothing out some of these areas since we're here. Okay. Really, this all looks pretty good, as you can see. Okay, pause for a minute. Okay, just want to show you, we're taking out this one suture because it was a little bit prominent. Again, nothing significant or severe, but now that's gone, so we even know that that's not going to be a problem anymore. Okay, so we're going to finish up here. I'll have a little more work to do with the shaver, but I don't see anything surgical that needs to be done. So that's good news. So that also means we don't need to get an MRI scan because there's really nothing better than the look we're having right now. Okay, so hopefully we can just work on rehab and get your motion back and take it from there, okay? So good luck to you now. Bye-bye.